Hi, I'm Apuyo Forikuma, your Heart of the Matter host. Now, as part of our special Mind the Gap X program, which focuses on families and the specific issues that they face, we'll be talking today about IVF, in vitro fertilization, one of the solutions that helps couples that are struggling with children to actually have children. Now, Lanre Olusola is going to be speaking with Mrs. Etang Abang, who is Fertility Counsellor at the Bridge Clinic, as well as with Dr. Ekundayo Omogbehin, the General Manager also at that clinic. They'll be telling us what IVF means. They'll be telling us who it actually applies to. And most importantly, they'll be demystifying it for us as well. It's nothing to be scared about or to hide in a closet because you're doing it. And actually, I'm sure they'll tell us why we should be thanking God, because it's one of the many ways that He helps us to have children. Stay tuned and enjoy this episode, and stay blessed.
These things sometimes are psychology.
I think the cost as one of the was a God experience. Wanted to find God, simply feeling like you're in fire. It isn't always so.
Tell us about the solution.
As one
People with 18 to 35 years of age, not out of work.
Hey, I don't have the skills for this particular problem to solve this particular problem.
None of us talked about the bread sign.
Hello, my name is Lanre Olusola, and I'm sitting in for Pastor Wale Adefarasin today. And today we've got a special edition, the Mind the Gap X series of the Heart of the Matter. And today we're talking about infertility and the IVF experience. I've got two wonderful guests with me today. I've got Dr. Ekundayo Omogbehin, the General Manager of the Bridge Clinic, and I've got the fertility expert and counselor at the Bridge Clinic, Mrs. Etang Abang. Welcome to the Heart of the Matter.
Thank you.
Thank you very much for having us.
Yes. So, Doc, Madam, you know, this matter of infertility, this matter of IVF, what is infertility? If you were defining it from a medical perspective and from the experiential counseling perspective, how would you define infertility?
Okay, thank you, Larry. I think basically, if we were to give a baseline definition to it, one would say infertility is the inability for a couple to achieve conception after 1 year of continuous unprotected sexual intercourse. So that would be a broad, description of what exactly infertility is. I mean, taking it a step further, by WHO standards, the statistics we have is that 1 in every 4 couples actually suffers from this challenge.
Infertility.
Yes.
Wow.
Yes.
So, Madam, how common is this issue in Nigeria, this issue of infertility? How common is it in Nigeria? How common is it in Africa? We realize that statistics usually is from America or Europe. So Dr. Dio says that 1 in 4. But from your counseling experience, how common is infertility?
Thank you, Dr. Olusola. It's very common, because the assumption is that once you see a woman pregnant in the society, you think it's natural, because they don't speak out. People come into fertility clinic, get assisted, and the pregnancy manifests, and they don't share their experience that, oh, I waited for a year, I waited for 6 months before I became pregnant. We just see a woman pregnant, we assume it's so natural. It is very common. Common in the sense that, not because it's a disease, but it's one of those life challenges that come along when you are ready to reproduce in the family.
So speaking about this, right, that means that this stigmatization is very real. Why? Why is infertility, why is it that stigmatized?
Well, I think let's look at it in the African context. I think it's only natural that when a couple gets married, they expect that within the next few months, the woman should be walking around with a little bump, and as such, when that doesn't happen, you find that the first person that is usually attacked in this whole episode is the woman. And in all honesty, you know, studies have shown now that it's actually not really the woman's, you know, there's a balance. Okay, statistics have shown that the woman, yes, 35% of the problem, the man, 35% of the problem, 20% combined and 10% unexplained.
Wow.
Those are the statistics that we have.
So they share
currently.
equal responsibilities.
Yes, absolutely.
70% is both of them, and 30% is outside of their control.
Outside of their control.
Wow.
But because of the culture that we're in, you know, the society we're in, you find that a lot of them, especially the women, now become stigmatized. Okay, because the man will tell you, oh, well, I'm up and doing, so it must be you, it must be your problem. And in most cases, it usually is not. Because of all the environmental challenges and things that we have now, the man is also actually affected.
Wow.
You know, so it's a problem that, as you rightly said, there's the stigma aspect of it, and, you know, we just need to create more awareness about it, because you find a lot of couples that they just suffer in silence, and you sit back and say, oh, well, it's not my portion. You live in denial, okay, that I must be good. I mean, I haven't done anything wrong while I was growing up. I never had, you know, intercourse outside, you know, all sorts of things. And then you start to live in denial, and that time just keeps ticking. Unfortunately, this challenge, as my colleague rightly put it, is something that you need to treat very quickly.
Wow.
As opposed to just leaving it to tick away.
All right, so you speak about the man just going on doing his own business, and from a woman's perspective, what are the effects of stigmatization? What are the psychological effects on a woman, and how can she handle this stigma? You know, so you're married and your parents are saying to you, when are you going to get married? They don't even look at the man, they look at the woman. When are you going to get married? 1 year goes past, 2 years go past, 3 years, and then they start to ask you, are you okay? You know, so from a counselor's perspective, how would you advise women to manage this issue, and what are its psychological effects?
Well, women, it's unfortunate that the women are bearing the brunt of the burden. But realistically, the men are the issue, if you look at it. When God said, a man will leave his family and become one with the wife, he gave the responsibility to the man. Where the man leads, the wife follows. Unfortunately, the society has turned the normal to be abnormal. You'll find out in some marriage settings, the man will say, until you become pregnant before I marry you. Why? It's abnormal. The Bible says, avoid premarital sex. Until you become one, then you enjoy the fruit of being together. The man now takes on that notion. She didn't get pregnant before we got married. Something must be wrong. So the marriage is already being judged. Just before they enter, they not get in. The woman does not manifest a pregnancy. What happens? Society now says, wow, this woman is not fertile. Perhaps there's a family member that did not, you know, support the marriage. Say that's why we didn't want her to be married. But what is the husband's role here? Take an aggressive step and say, okay, if nothing is happening, can we check out ourselves? We are one. But what happens? The man distances himself, and the woman now speaks out, starts looking for help, support. She comes for counseling. She goes for checkup. But as we have seen, it takes two to tango. The man and the woman must make the pregnancy happen. But the woman is out there trying to exonerate herself, but she still cannot. The man sits out. He is affected, but he is not coming out. So the woman is now being stigmatized by society that the man is okay, it's the woman.
Wow.
And she bears the brunt. However, there are a lot of men here, and there are a lot of listeners listening now. The onus is on the man to take the lead. When the man works with the wife and they go through the process, help comes naturally. Support comes naturally, and they can overcome fertility. But stigmatization will remain for a long time as long as the man takes the back seat and throws the woman to the public. She remains judged.
So it's our responsibility as men, and we must take personal responsibility to protect our wives against members of our family, to protect our wives against society, and say that there's absolutely nothing wrong with us. And, then it brings me to the Bridge Clinic. Now, when people come in, or people are seeking for insight about the reasons why, children have not come, what are the first steps? Well, what do you advise? What are the options, to help them, to give complementary, interventions? What are the options available to different? Are there different categories of infertility, and are there different, are there different interventions that are required?
Yes, definitely. Thank you for the question. I think, let me take it from types of care. You can, at the Bridge Clinic, we have primary, specialist, and advanced. Okay? Now, you may get married, have children, and then for some unearthly reason, there may be a delay. Okay? That's called secondary infertility.
Wow.
Okay? So there are various degrees, okay? But what we have seen in our 16 years of experience is that you need to be able to treat it as, well, not treat it, but get intervention as quickly as possible. And because we have realized this, we at the Bridge Clinic have come up with a set of tests called Fertility Show. It's a bouquet of tests. And what we try to do with that is encourage not only intending couples, but even young individuals, and also people that have just gotten married, come in and get yourself checked. Know what your fertility status is. Okay? Unfortunately, in this part of the world, we say we are religious, and because of that, we hide a lot. No, I'm being very honest. We hide a lot and say, it's not my portion. By faith, I'm healed. And yeah, faith is wonderful. Don't get me, it's very wonderful. But faith without works is actually dead. So you need to take that step of faith. Go and find out your fertility status. How exactly are you doing?
Wow.
Okay? Before you get to IVF, there may be little things like hormonal imbalances. There may be little things like weight management. You understand? There are various things.
Wow. I'm really getting into this, but, we're going to take a break. But before we take the break, the Bible says that my own people are destroyed for lack of knowledge.
Absolutely.
So it is not Lucifer, the devil, demons, or people from your village sometimes that are, the problem is because you are ignorant.
You just haven't opened your mind and accepted that fact and taken that step of faith.
Yes, ignorance. Wow.
Yes.
So, like they say, don't touch that dial. We'll be back after the break. Welcome to the special edition of The Heart of the Matter. We're still talking infertility and IVF, the experience. So, Dr. Dayo,
Yes.
So when you come for a test and you realize that, you have a particular challenge that needs correction and, it will be difficult for you to go through the natural process of getting pregnant, what are the options? What are the complementary interventions that you usually recommend?
Okay, first of all, let me take us a step back. Like my colleague said earlier on, when we are treating for the challenge called infertility, we usually treat the couple. Okay, because it has to do with both of them. It's not just about testing one person and leaving the other person out. And I'm sure, a practical example of that is maybe a couple that have been married for a couple of years, they haven't achieved that conception, and then all of a sudden the man or the woman gets some form of brainwave, if you like, and goes out and goes to impregnate somebody else. Okay, so it's important that we treat the couple because they complement each other. Okay, now after you've come in and you've taken this test, it's the outcome of the test that now determines the treatment. Like I said earlier on, it may just be that you have a hormonal imbalance. It may mean that the man also needs to be treated so that his sperm gets a little bit better, or it may be a weight problem. Okay, IVF is not the all and all. It's after you've assessed, you've reviewed the entire case, and you see that there is no other option but IVF. That's when you use IVF. Because basically what IVF is you take the egg out of the woman, take the sperm out of the man, inject it, and then implant it back into the uterus so that it grows into a normal baby.
All right, so let's look at it from this perspective, and we'll come back to you, Ma. So if you do the test and you realize that the man's sperm, he has a low sperm count, or he has a low motility rate and all of that, and he's the guy. You've just tested the woman and you found out that her eggs are good. What are the causes of low sperm count, lack of mobility of the sperm, and motility, and what are the things that you recommend?
There's not been any study per se that has said, okay, this is what causes the sperms not to be motile, or the sperms to be deformed, have two heads, or not be swimming properly. I think it's more or less a function of lifestyle, and also a function of what, lifestyle in general, because the environment, there's so many pollutants. Even the Coke you drink from a plastic bottle has its effects. There's so many studies going on.
So what are the common things? So when you say lifestyle, generally, so that our listeners out there can begin to make adjustments.
Alcohol, smoking, those are basic things.
Smoking,
yes, smoking,
eating,
alcohol, having fatty foods, things like that. So you need to be a bit healthy.
So your sperm becomes horrible too, in a sense.
Not horrible, no.
So it will not move as fast as...
Yes, the motility may be reduced, it may be deformed, have two heads. A normal sperm has a little head and a tail, and that tail is what makes it swim very fast. So deformed sperm, or, it's basically lifestyle, basically.
All right. So now, when a couple comes and they realize that there's a problem, how do they usually handle it? And as a counselor, what are the tips and advice that you give them?
First, most of them that stray into the clinics, they don't get straight to telling you that they have a problem with their reproductive system. They go around their periods for the woman. It's mostly the women that come first. And when you try to find out about how the period pattern is going, you find out that she's been having this issue for over some years, and that has not resulted in pregnancy. So you now begin to find out what actually the journey they have taken before coming in there. On few occasions, the men come in and say, look, this is the issue. Those are the 1% of African black men that we have. Few of them come in and say, this is the issue. My wife is very busy. I have come to make inquiry. We've been married for 2 years, 3 years, nothing has happened. And I read about Bridge Clinic on the social media, and I'm here. So I'll take them through the patterns of what we do. You come for consultation. During that consultation, a full reproductive history is taken. Have you been to your MO? Have you been to your ONG doctor? What has happened? What tests have you done? We go through that. The next test for the man is, we said, you have to produce semen for us to analyze. I need to really pause here and explain. When you tell a man that he should produce semen for analysis, it's like you have asked God to come down. They take a step back. You are asking for too much. That's where counseling comes in a lot, to encourage him, to make him not to feel, maybe you already sense there's a problem somewhere. It takes a man quite a while to produce that semen, and that's what delays the treatment, and that's what makes them not to come out. Once they produce the semen, it's been analyzed for what doctor has said, to find out some of the exudate that comes out from intimacy does not contain sperm, unfortunately. As young as 30, we are found in the clinic. So when doctor is talking about fertility, sure, come and assess your fertility status. Some churches are adopting it now, that after your sickling test, you go and, assess your fertility status. Just fertility, sure, check out. Is everything okay down there? The fact that the man is meeting with the wife and there's something coming out, they ejaculate, does not confirm that there is sperm there. So we want to know
so
that.
What you're saying is semen and sperm are two completely
Two different things.
Semen is the vehicle that carries the sperm. So you might have
fluid.
You might have semen, but absolutely no sperm. So the man can be deceived into thinking that because there's something coming out, he's actually on point.
Wow.
So one of the things that sticks out for me here is when, Madam, you talked about the man seeing it as a mountain to produce sperm, and I'm trying to relate it to myself as a man. That is touching my ego,
Yeah.
And I will feel less of a man.
Yes.
When you tell me that, it can possibly be me, and it can possibly be the essence of my manhood. And if I produce the semen and there's no sperm in it, you're saying to me I'm not a real man. That's what it sounds like. But really and truly, it is not so. Your spirit, your soul, and your body, and the entirety of your being is what makes you a real man, not your semen. And that is one of the things that I believe restrains men. It's just like you're doing a blood test for maybe typhoid, or, you have a bacterial infection or a viral infection, and this is where I find that a lot of Christians don't play ball because they want to faith it. And a lot of them have tried to faith it for 10 years, 15 years, 20 years. And you don't know how much pain your wife is going through. Your wife knows that, she has checked herself. It is not her. Go and check yourself. Year 1, no, I'm not going to. Year 2, I'm not going to. Year 10, I'm not going to. I mean, can you just imagine the kind of pain that you'll be putting your wife through? So in this situation, what is usually the effect on the relationship? In a situation where the wife seeks help, the husband reluctantly comes, and, you say to them, why don't you produce semen, and the man is stalling. How does it affect the relationship?
Thank you for the explanation you've given. Is the simple reason that a man equates his fertility to masculinity makes him feel that he's less of a man when there is no sperm found. And it's not anybody telling you, it's the fact of the matter. It's a scientific result that confirms that there is no sperm. It affects the man beyond that. He feels very impotent. And that translates into physical impotency. And that affects the relationship between him and his partner, which breaks the social contract of roles in the marriage. So you find out they begin to isolate themselves. When they isolate themselves, they become husband and wife, but mates in the house that have different retreat corners.
Roommates, wow.
It's as bad as that. And then because, like we say, the culture encourages it. It's not a Christian culture. He goes out, he ejaculates, and somebody claims without a DNA test that is expecting for him, voila, that marriage is gone. So the woman continues to suffer in silence. However, also, like you say, the woman suffers in the sense that even if all known facts say there is no sperm in the exudate, the woman may have a minor problem. The man does not even say he has a problem. He begins to take a microscopic view of blame and guilt on the woman that, after all, there is that problem in you. Counseling role is just to ensure that they work together.
Wow. There's also the opportunity for a lady who is young and perhaps is chasing her career, etc., and wants to keep her own eggs as opposed to using donor eggs after the age of 35, to be able to have that service as well, so she can cryopreserve her eggs.
Wow, wow. So
There's a lot of things science can do now.
Wow. So aren't we trying to play God? In rounding off,
No.
Aren't we trying to play God? Because, I would imagine that a lot of Christians out there are thinking, well, you get egg from somewhere, get donor sperm from somewhere, and then they will take the sperm and put it into the egg, and they do IVF, and then. I mean, how do you see it as a professional? Aren't you trying to play God?
The answer is an emphatic no. Nobody can take the place of God. And at the end of the day, no matter what science, even though he gave us the knowledge, no matter what science is available to us, if he doesn't say yes, it is not a yes. Okay, so I look at us as worthy instruments in the hands of God. We are just assisting a miracle to happen.
Wow.
That's the way I look at it.
Aren't we playing God?
When the doctors take the hypocritical oath, they swear unto doing all that is good within the ambits of pleasing God. And the knowledge of science comes from God. Genesis said that herbs have been given unto us to use, and herbs have transited into the scientific drugs we are using. So when you now translate, everything is in the Bible. What is happening, the knowledge of medical school enables a doctor to understand how the body works. And in understanding how the body works, you'll now be able to apply solutions to when the body is not working. And that's what applies to IVF. Just taking the sperm and, mixing it with the eggs that have been collected. And then we have incubators that are like wombs that have been made, so that you see this scientific evolution taking place before you transfer. And then we say at the clinic, God takes over. Man's work has stopped. When there is a breath of life, then IVF succeeds. But at that period, all the process is the knowledge that God has given unto man, which the boss said, we can't perish because we now have knowledge.
Wow, we're not trying to play God. We're just trying to work, what God has already put in place. We did not create the sperm, neither did we create the eggs. And according to Jeremiah 8:20-22, the Bible says the harvest is past, the summer is ended, and we are not saved. Since my people are crushed, I am crushed. I mourn, and horror grips me. Is there no balm in Gilead? Is there no physician there? Why is there no healing for the wound of my people? And on that note, thank you very much for, shedding a lot of light on this infertility issue. We just sincerely and truly hope that all our listeners out there have been blessed. I certainly have been blessed. And from me, you must realize that we cannot conclusively deal with all the issues of infertility, the stigma, and IVF. And that's why we're holding a program called Mind the Gap X on the 10th of September at the Guiding Light Assembly. And we're going to be dealing with a lot about infertility and IVF. And this is a special edition of The Heart of the Matter. Thank you for tuning in. My name is Lanre Olusola.